we have finished our conversation regarding the anatomy last time, and today we're going to chat about the anatomy of the skeleton. So it's about the skeleton bones represent about 20% mass of your body, and it consists of two major parts: the axial skeleton, which is shown in this picture in blue. It involves skull, vertebral column, and thoracic cage, and appendicular skeleton. It includes bones of the limbs, upper and lower limbs, and pectoral and pelvic girdle. Axial skeleton has less bones than appendicular. Axial has 80, appendicular has 126 bones. Pectoral girdle attaches the upper limbs to the axial skeleton, the pelvic girdle lower limbs. So we're going to start a conversation by talking about the skull. And the skull can be divided into two parts. The cranial bones form the enclosure for the brain. They are shown right here. Okay. These bones, among others, involve frontal, occipital, parietal, and you will see that those names sound familiar to you. Speaking of which, if you open those black boxes, and I strongly suggest to do so because some of the questions on the anatomy exam will be modal based, if you open those boxes contain skulls. It's my experience, previous experience with anatomy exams that are modal based, suggests that hands-on experience, the tactile, the kinesthetic experience with bone models greatly adds to your grade. Let's put it this way. So touch them, please. Touch them, roll them in your hands, look at them. Right? So cranial bones enclose the brain, and facial bones responsible for the, obviously, facial features. Okay? Cranial bones can be divided into two separate subgroups. This part right here is called calvaria. Pretty much the lead of your cranium. That's calvaria. These bones, fragments of those bones, they form the cranial base. Side of the cranial base, you can see three fossae: anterior fossa, middle fossa, and posterior fossa. Does that make sense? Fossa, as we mentioned before, is the shallow depression. And in this case, the shallow depression houses human brain. The outside, especially those projections on the occipital bone, they will represent the attachment sites for the muscles of the neck and the back. You would look at the facial bones. You will notice that they have a lot of cavities, openings, right? So cavities that you can find include external acoustic meatus, opening for the ear canal. Can you see it? This guy is. Okay. TMJ in this dude is totally dislocated. Orbits. Can you see the orbits? Can you find the orbits? No, screw that. Orbits. Okay, oral cavity. nasal cavity. Those are openings for the organs, sight, taste, smell, and so on and so forth. But also, I mean, we do not cut it here, but if you will make a coronal section of the brain, of the skull, like shown here, you will see that in addition to those cavities that are quite observable, like orbits or oral cavity, there are sinuses, okay? Maxillary sinus, frontal sinus, ethmoid sinuses. The sinuses make your skull lighter, and they also help to resonate the sound of your voice. Facial bones represent the sites for the attachment of teeth and facial expression muscles. If you would look at the jaws of in the skull, you will notice that there are little projections between the teeth, alveolar processes. So essentially, bones are in those in between the alveolar processes in the skull. Also, if you would just rotate the skull around, you would notice that there are a lot of openings, different fissures, like inferior orbital fissure, foramina, like superior orbital foramina, okay, mental foramen. All those openings are the sites of passage for nerves and blood vessels. Now, before we move on, I want to kind of calm you down. I will post the list of the structures, anatomical structures, that you have to know in regards to the skeleton. And I always say it's a closed list. By closed, I mean I will not ask anything outside of that list. Does that make sense? Good. Bones of the cranium. Frontal bone. Now a little bit of familiar terminology. You have heard all those names before when we talked about the lobes of the brain. So frontal bone, here it is shown in a beige color, forms the anterior portion of the cranium. If you would look inside of the cranium itself, open the calvaria, forms the most of the anterior fossa. Participates in the formation of orbits, forms superior walls of orbits. You can see it right here. And it also contains the frontal sinuses. Normally, sinuses filled with air. If you have a condition known as sinusitis, they become filled with the mucus secretion usually, sometimes purulent secretion. It's a bacterial sinusitis. And you press during the sinusitis, if you press on the frontal sinuses, they start to hurt. Because instead of being filled with air, they filled with the inflammatory exudate. Parietal bones, shown here in pink, form lateral aspects of the cranium. Now you can see two parietal bones. Okay, parietal bones are separated from the frontal bone by this line. Can we call this line a joint? What is the definition of a joint? Not necessarily. Bones coming together. Period. That's definition of the joint. Joint doesn't have to be movable. Does that make sense? It doesn't have to be movable. So suture is immovable joint. Okay? Yeah, so this suture is called coronal. Kind of makes sense because it loosely lies in the coronal plane. Does that make sense? Sagittal suture, which you can see right here. Okay. Sagittal suture is here. This is the temporal, the squamous suture. So sagittal suture separates parietal bones. The squamous suture separates temporal and parietal, and lambdoid separates parietal and occipital bones. Does that make sense? Those sutures are joints, and actually if you would look at the craniums that you have, look at the lambdoid suture here, separating the occipital bone and parietal bones. Can you see, I would say not on the painted skull, but on the regular plain skull. Look at the lambdoid suture. Can you see little tiny bones inside of the suture? Can you see the bones in the suture? Those bones are called sutural bones. They belong to the class of sesamoid bones. Okay? Does that make sense? Occipital bone forms most of the posterior part of the cranium. Here, on that illustration, you can see occipital bone in that light brown color. It contains several important structures. First, foramen magnum, large opening at the bottom of the cranium. Can you see that? Foramen magnum. Foramen magnum, right here, is the place where brain stem comes through the into the cranium. That makes sense? So here it's the opening for the brain stem / vertebral column, spinal cord. Does that make sense? Sorry. At the attachment of the first vertebrae can be seen on the occipital bone right here as so-called occipital condyles. These are occipital condyles on the bone, and they articulate with the first vertebrae of the vertebral column. You can stop by Marvin later and see the articulation. It's pretty clear here. Temporal bones that have this lovely fine shape can be found on the lateral aspects of the skull, like inferior lateral aspects of the skull. And they have several regions. The flat region is the squamous one. So that's the squamous region of the temporal bone. Tympanic region is around the external acoustic meatus. It's roughly this one. Mastoid region is this, around this mastoid process on the temporal bone. And petrous region is the posterior aspect of the bone. Here. Petrous in Greek means stone. In this case, it refers to the thickness and toughness of the of the petrous region of the temporal bone. Does that make sense? Before we move on to the facial bones, let's talk about cranial bones one more time. This is what? Frontal. This occipital. Those two are parietal bones. This and this are temporal. Frontal and parietal are separated by plane. Coronal plane, so coronal suture. Two parietal bones are separated by sagittal suture. Occipital and parietal bones are separated by lambdoid. That's the Greek letter lambda. Okay? And temporal and parietal separated by squamous suture. Good? Two more bones that form the cranium are sphenoid and ethmoid. Sphenoid bone, shown here, sometimes it is referred to as bat-shaped. I prefer to say it's the butterfly-shaped bone. It's the keystone bone. If you open the calvaria of the skull, look inside, you will see sort of parts of the sphenoid bone inside. It forms most of the middle cranial fossa. Okay? There are several notable processes of the sphenoid bone. Greater wing and lesser wing. If you would look from that standpoint, you will see the greater wings and the smaller projections called lesser wings. Pterygoid processes can be seen on the inferior part, the ethmoid bone. So it is called keystone bone since it articulates with all other cranial bones. Here in this image, you can see it in pink color, and again, if you would look down onto the middle cranial fossa, you will see that it is formed mostly by the sphenoid bone. Side of the sphenoid bone is the very interesting structure right here. You see it? So I put my finger in, I remove my finger. Put it in, remove it. Can you see the structure? The structure is called Stella turcica. Sella turcica, I think so. Is that Sella? Yeah, Sella turcica. In Latin, Sella turcica means Turkish saddle. I have no idea why it's Turkish. Probably because Turks were riding in those saddles. But this is the site where your pituitary gland is housed. So that's not just a depression, that's where pituitary gland is. Okay? That makes sense. Now, ethmoid bone. So that's going to be sphenoid. Ethmoid bone is the deepest bone of the skull. It's rather small. It's a regular bone. You can see several structures that notable here. The perpendicular plate of the ethmoid bone, you can kind of see it here. It forms the nasal septum. Okay? If you would look down the nasal cavity of that skull, you will see the bony structure that separates nasal cavity into the left and right nostril. Can you see that? The superior portion of that septum is the perpendicular plate of the ethmoid bone. Another important structure in the ethmoid bone is cribriform plate, right here. So cribriform plate is the part of the bone with the little tiny holes. They're not really holes here on that model, but they are in the actual human. Through those holes, the filaments of the olfactory nerve penetrate from the nasal cavity, from the olfactory epithelium towards the olfactory bulb. That makes sense? So those bones constitute the cranium. Frontal, that's 1. Occipital, that's 2. 2 parietal. 2 temporal, it makes up 6. Sphenoid and ethmoid. So a total of 8 bones of the cranium represent the cranial bones. Does that make sense? Facial bones. Mandible. It's the largest facial bone, strongest facial bone. Actually, if you would look at the archaeological findings, in the early humans sometimes used mandible as the weapon, bludgeoning weapon. Of course, not human mandible. They got something more, robust, profound. Site of attachment, the lower teeth. Those alveolar processes between the teeth. Okay? They separate one tooth from another. Body and ramu of mandible constitute the main framework. Condylar process, right here, articulates with the mandibular fossa on the temporal bone. So if you would look at the cranium, you will see that condylar process right here moves, right? Representing the temporomandibular joint, the joint between the temporal bone and the mandible. Temporomandibular joint is the only joint that moves in the skull, and it's most easily dislocated joint in a human body. That makes sense? Foramen, like mandibular foramina, mental foramina, are the openings for various nerves that innervate facial muscles. Maxillary bone, shown right here. In this image, you can see maxillary bone in that, violet color, whatever you want to call it. Okay, so maxillary bone, which forms big part of the nasal cavity, upper jaw, is fused. Initially, the fetuses have 2 maxillary bones that fuse medially here. Okay? This is the keystone bone. It articulates with every other facial bone but mandible. Technically, this teeth to teeth is not an articulation, because bones do not articulate with each other. Maxillary bone contains maxillary sinuses right about here. Those are the largest sinuses that humans have. So when you have sinusitis, not only this pressure causes the pain, but this pressure causes the pain as well. Posterior to the maxillary bone is the rather small palatine bone. Here in this model, you can see the maxillary bone, and then posterior to it, palatine. Palatine constitutes about 1/3, posterior 1/3 of the hard palate. The roof of your oral cavity, it's the soft palate and hard palate. Okay, so palatine is posterior 1/3 of the hard palate. Also constitutes a part of the nasal cavity and orbits. It's actually quite complicated, structurally complicated bone. You can see, if you look down there, you will see that palatine bone forms a bit of an orbital wall and nasal cavity wall. Zygomatic bone, pretty complex shaped. Here on this image, it is shown in the blue color. You can see zygomatic bone right here. That's zygomatic. Okay, see that? These are your cheeks. That cheekbone. Okay, forms a large portion of your orbital margins. You can see right here. Okay. Nasal bones form the bridge of the nose. So when somebody gets the nose broken, that refers first and foremost to the break of the nasal bones. Okay. Rather small bones that are called lacrimal bones form the medial walls of the orbits. They're not painted, they're really hard to see, but if you look into the medial walls of orbits, look here. If you look down, you will see the sac and the foramina. Can you see that? They're shown here in green, not very clear. The lacrimal bones. But you will see this foramina. What goes through that foramina? This one, in the lacrimal bone. Huh? Where's lacrimal? Tears, but through what structure? Nasolacrimal duct. Lacrimal gland is right here. Right? That's where lacrimal gland is. Tears flow medially and drain through the nasolacrimal duct into the nasal cavity. Okay? Look down the nasal cavity of the skull. You will see, as I mentioned, that it is separated into left and right nostril by the septum. The inferior portion of the septum is formed by the unpaired bone that is called vomer. It's plow-shaped bone. Okay? The superior walls of the nasal cavity are formed by the maxillary bone with projections called superior and medial nasal conchae. Now, inferior nasal conchae forms the inferior walls, lateral walls of the nasal cavity. If you would look down there, you will see. Look down there. It's really hard to appreciate, though. On the modal, it's really hard to appreciate the inferior nasal conchae. You have to understand that superior and middle nasal conchae are folds. Does that make sense? Superior and middle nasal conchae are folds of the ethmoid bone. Inferior nasal conchae is the separate bone. If I say folds, what is the role of those folds? Increase surface area. Just out of curiosity, why do we need increased surface area in the nose? The olfactory epithelium is in the roof, not on the conchae. What do we do with air in the nose? And, say again? Yeah, but what happens to the air in your nose? What? Yes, so filtration first. You filter all the crap out of the air. If you inhale cold air, it is in your nose. Well, it's cold. You need to warm it up. Yeah. Those capillaries in the conchae, in the mucosa of the conchae, they constantly do the heat exchange. If it's too cold, they will heat it up. If it's too hot, they will acquire some warmth from it so it's not burning. Okay? Also, if it's too dry, there will be humidifying effect from the mucosa. The more surface area you have, the more effective those processes are gonna be. Does that make sense? Okay. Now, if you would look again into the nasal cavity, you will notice that nasal septum is not complete. That makes sense? What completes nasal septum? So-called septal cartilage. So if you touch your nose and we'll start to move it left and right, I mean, it's pretty flexible. That's why when somebody gets the nose piercing, whoever makes it, they don't have to drill it like through the bone. Okay, it's the cartilage. It's not a bone. It's pretty soft tissue. Does that make sense? That's why, when you get hit, it's painful, but cartilage gets squished since it's soft. Only if you get hit right here in the nasal bones, then they get broken. Does that make sense? Let's go over the bones of the face again. So this is mandible, right? With condylar and coronoid processes. Condylar process forms temporomandibular joint. Alveolar processes are in between the teeth. The upper jaw is maxilla. Maxilla forms anterior 2/3 of the heart palate, and posterior 2/3 are formed by palatine bone. Maxilla is initially two bones, which are fused together. Okay. Big part of the orbits is formed by zygomatic bone, which articulates with the frontal bone, temporal bone, maxillary bone. Bridge of the nose is formed by nasal bones. The medial walls of the orbit are lacrimal bones. Inside of the nasal cavity, you can see inferior nasal conchae and vomer. Inferior nasal conchae form lateral walls of the nasal cavity. Vomer forms the inferior part of the nasal septum. Nasal septum by itself is formed by the perpendicular plate of the ethmoid bone, vomer, and the septal cartilage, which is not present in this model. Does that make sense? Now, if you're going to study, first of all, I think library has modules. Does that make sense? I think library has modules of the cranium. Second, what I just said, try to articulate it this way. Not just this is that bone, this is that bone, but this bone forms the anterior part of the cranium. It's a frontal bone. Occipital bone forms the posterior part and the base of the cranium. Parietal bones form posterolateral walls of the cranium, while temporal bone forms inferolateral walls of the cranium. Does that make sense? They have such parts, they form orbit or they don't form orbit and stuff like that. Again, you're going to have a list. Am I clear? Awesome. Orbits have several fissures. Superior and inferior orbital fissures and optic canals. Okay? Fissures are the passages for blood vessels and extrinsic eye muscles. Optic canal is, not surprisingly, the opening for the passage of the optic nerve. Okay? 7 bones form it. Frontal, sphenoid, ethmoid, lacrimal, maxillary, zygomatic, and palatine. I believe it's not clearly seen here. Yeah. Well, a little bit of palatine right here. So 7 bones form the orbit. Cavities. There are 4 major groups of sinuses in the head. Maxillary sinuses, frontal sinuses, ethmoid air cells, and sphenoidal sinuses, which I can't show you because they are deeper in the skull. So when there is, when you say your head aches, when you have sinusitis, it's actually increased pressure on the sinuses because of that inflammation and infiltration of inflammatory cells in the sinuses. Does that make sense? That is one of the reasons why when you have sinusitis, your voice starts to sound different. Not only because of your nose is stuffed, because sinuses are filled with purulent infiltrate. They full, not of air, but of stuff. And that totally changes the resonance of the sinuses. Does that make sense? These 2 slides are for your review. I will, during the short break, if I will have like 2 minutes, I will upload them today after the end of the day. Upload the labs. Sort of an exercise to work with those pictures and label the bones and the openings and stuff like that. That makes sense? Awesome. This is the bone that I hate the most. It doesn't belong anywhere. Hyoid bone. Right here. See it? It's hyoid bone. Attachment of the muscles responsible for speech. So everything that moves the tongue, moves the internal muscles of the neck, needed to speak, to swallow, show your tongue and stuff like that. Okay, still a part of the axial skeleton. Now here, Marvin has it wired, sorry, to the vertebral column. No. That makes sense? No, it's not wired to the vertebral column. It doesn't articulate with anything. Vertebral column. The function is to transmit weight from the trunk to the lower limbs. Also, it encases the spinal cord and protects it from possible damage. Contains 26 irregular bones. So 7 bones in the cervical portion. 1, 2, 3, 4, 5, 6, 7. Okay. 12 bones in the thoracic. From here to here. 5 in the lumbar. 1, 2, 3, 4, 5. 5 fused in the sacrum. Can you still see me here? That's sacrum. And 1, 2, 4, depends, coccyx. Used to be the tail. You don't have the tail anymore. It's tailbone. Okay? That makes sense? You would look at the vertebral column, it's not straight. It has curvatures. It has 2 concave curvatures, cervical and lumbar. And vertebral column bends posteriorly, and it has 2 convex curvatures, sacral and thoracic. So it bends forward, it bends anteriorly. Does that make sense? Now the idea of those curvatures, it's like a spring. Did you see those people who lose their limbs? They sometimes, if they pick up running, lower limbs, I mean, they have those special prosthetics that are bent like this. That bending provides the spring action. Same goes for the spinal cord. Those curvatures provide resilience and spring action. They buffer, okay, the weight. Every time you jump, when you jump from somewhere, what are you taught to do? What do you need to do with your knees? You have to bend your knees, right? You have to provide that spring action. Same happens to a vertebral column. It provides that spring action. That makes sense? Good. Sometimes curvatures become abnormal. 3 major types. Scoliosis is the abnormal lateral curvature, sideways. Kyphosis, or hunchback, is exaggerated thoracic curvature, which means there's a little bit hunch here. Okay. Common for older people, especially because cartilage becomes calcified, intervertebral discs become calcified, and that decreases the buffering capacity, mechanical buffering capacity of the vertebral column, so you try to compensate it by leaning forward. Also, another major contribution to the proper posture is the strength of the back muscles. That's actually main contributor to the proper posture. When your mom was telling you don't write like this, you will become a hunchback, that is not true. You're not going to become a hunchback from writing like this. You're going to become a hunchback if your back is weak and cannot hold you up. Does it make sense? Another condition which is usually transient, hunchback? It depends on the strength. I mean, generally, men tend to exercise more and focus more on, Osteoporosis will contribute more to the weakness of the vertebral column itself, the bones in the vertebral column. Not necessarily related to osteoporosis. Bone break will be related, yeah. But it's a good question. Now, lordosis, that's entirely female. That's usually transient. It's an attempt to compensate when the lumbar curvature is being accentuated, okay? Trying to compensate for, what you might call it, excessive weight on the anterior surface, essentially for the fetus. Okay, when women are pregnant and they have to carry huge load, how you carry something heavy? You carry it like this. You lean backwards. You accentuate your lumbar curvature. When you have to do it 24/7 for several months, the curvature of your spinal cord will change. It will go away after the delivery. That makes sense? Now, those vertebrae are not just stacked one on another, they are connected by ligaments. Anterior and posterior longitudinal ligaments. Okay? Here you can see the anterior ligament. Okay? And also ligamentum flavum, which runs pretty much inside of the vertebral column and connects the vertebrae. So if you think about this, it's like a chain. Many links of that chain, I don't have them. Do I? Many links of the chain are connected to each other. They provide pretty good protection to the spinal cord that's inside, and at the same time, they're pretty flexible due to all those ligaments that connect them. Now, I took the liberty of getting the disarticulated skeleton for you out, so now it's going to be a good time to look at the individual vertebrae, and I will guide you through this. So, discs between the vertebrae, composed of two parts. The inner part, which is soft and gel cushion-like, called nucleus pulposus, allows disc to be compressed, elastically compressed. When you lift something heavy, this gel cushion, nucleus pulposus, provides the necessary flexibility. Annulus fibrosus of the disc is the fibrocartilaginous collar which resists the compression and gives that mechanical sturdiness to the intervertebral discs. In case there is some abnormality to the structure of annulus fibrosus, or there is an excessive force that was applied to the vertebral column, often in a sliding manner, so when vertebrae slightly slide against each other, so the force is applied not vertically but sideways, the disc can become herniated. Herniation of the disc may lead to the pressure on the spinal cord, which may lead to the paresthesia or paresis, so temporary loss of control of the muscles or temporary loss of sensory perception in the different regions of the body. Okay, does that make sense? Or it can press on the spinal nerve, which may lead to the chronic back pain, also impaired functionality and control over certain muscles and sensory input from regions of the body. Does that make sense? Now this is the MRI which clearly show you the intervertebral discs and the one that is herniated and protrudes into the spinal cord. Does that make sense? On this models right there, you would look at the third from the left. It's actually it shows it pretty well. You can see the normal discs, and there is an intervertebral disc between the lumbar vertebrae 3 and lumbar vertebrae 4. It is shown as this red protrusion. That's the hernia. Does that make sense? Now let's talk about vertebrae. First of all, general structure of a generic vertebrae. I want to see if I have an isolated. Yeah, I do have an isolated vertebrae. So this is vertebrae. You have yours on the line. I suggest not to take them away because it's a little bit of a hassle to put them back. Okay. So vertebrae consists of several parts. First of all, body. That part of the vertebrae is bearing weight. That's why it's, large and thin. Processes. Spinous and transverse. Those are transverse processes. That is spinous process. Spinous process of the vertebrae is always oriented to the back. So if you touch your vertebral column and you feel those separate bones, that's the spinous processes. Okay? Vertebral arch is formed by the vertebral lamina, the posterior portion, and the vertebral pedicle. So that's the lamina. Those are pedicles. Altogether, they form vertebral arch. Vertebral arch and the body of the vertebrae form that opening that is called vertebral foramina. Okay? That vertebral foramina houses the spinal cord. So far, do you follow me? Do you understand anatomically what's that? So if you would look at this, at Marvin, you can look at him during the break a little bit. Instead of the spinal cord as a gigantic, not gigantic, but like a metal spike going through all the vertebral foramina of all the vertebrae. Does that make sense? Now, if you would take two vertebrae together, like this, you will see that on the sides, two adjacent vertebrae form intervertebral foramina. Look at Marvin. Can you see these holes? Okay? Now, if you would look at those models, the side, those yellow plastic protrusions that go in the transverse plane out of the vertebral column, what are they? The yellow plastic things. Nerves, yeah, those are spinal nerves. So those spinal nerves leave the spinal cord through the intervertebral foramina. Okay? Those intervertebral foramina where the spinal nerves leave the vertebral column. Does that make sense so far? Awesome. Articular processes. What is articular? What is articulation? Contact between the bones. So again, if you would look at this necklace, and you take two adjacent vertebrae, okay, there are processes, little tiny processes, through which they articulate with each other. The upper vertebrae uses inferior articular processes. The bottom vertebrae uses superior articulate processes. Can you see them? Can you see them? Blink once if you can. Blink twice if you cannot. Okay, good. That was not blinking. Okay? You understand? Now, I can't really... Well, if you would look from this vantage point on the vertebral column, especially the thoracic region, just 1 second, yeah. Can you see these tiny little protrusions? These two? Those are inferior articular processes. These two that I'm tapping on are superior articular processes. Please, I don't know how it looks from your point. So if you want me to turn it down, up, please tell me. I don't really know what you see there. Does that make sense? Okay. Now, not all the vertebrae have very noticeable processes and whatnot. And then they processes can look different. Now, that's what we're going to talk about. First, we're going to talk about cervical vertebrae. First 7 vertebrae are cervical, and they have several unique features. So I'm going to skip first 2, but if you would look at the typical cervical vertebrae, find something like that. So cervical vertebrae, what it has, what makes it particular? And speaking of anatomy exam, not only you will have to recognize the elements of the vertebrae, you will have to answer what kind of vertebrae do you see. So I show you, and you tell me. Does that make sense? So I show you, and you tell me. Cervical vertebrae is probably the easiest to recognize from C3 to C7. I want to highlight it specifically. So this one, well, this one is C6, but I'm not going to ask you the number. By the way, that's another thing. I can show you the disarticulated vertebral column, so like individual vertebrae. You won't have to tell me the number. The question will be, is that cervical, lumbar, thoracic, atlas or axis, okay? For typical cervical vertebrae, from C3 to C7, there are several important features. First, the body of the vertebrae is very small. Why? See again? Yep, not a lot of weight. Does that make sense? Second, bifid spinous process. Do you see those two ends? That's called bifid. Right? Second, transverse foramen. Sorry, which cranial nerve goes through the transverse foramen here? C11. Starts with A. Kind of helps. The accessory nerve. Remember, accessory nerve originates in the spinal cord, goes through the transverse foramina, and enters through the jugular foramen into the cranium. So this transverse foramina can be found only in the cervical vertebrae. Does that make sense? Transverse processes, on the other hand, are very small. And the vertebral foramina, what shape does it have? Generally. It's actually triangle. It's not even semicircular, it's triangle. So cervical vertebrae have triangular vertebral foramen. Okay. The very last cervical vertebrae, which is called vertebral prominence, here doesn't have the bifid spinous process. That's what differentiates it from others. Okay, so please, you will have to tell them apart, and it's not hard. First two cervical vertebrae have very specific structure. I'll try to find them so I can show them to you disarticulated. So that's one. Okay, awesome. So find the very first cervical vertebrae. It is called, it's called atlas. Okay? So that's atlas. C1. You can see that atlas vertebrae, or first cervical vertebrae, doesn't have body and doesn't have spinous process. I mean, it's not really a spinous process right here. It does have transverse foramina, and it does have articulate facets. Now, these articulate facets here, they articulate with the specific structures on the occipital bone of the cranium. They articulate with occipital condyles. Does that make sense? So this is what it looks like. Atlas is responsible for yes movement. Okay? Second cervical vertebrae is called axis. If you cannot recognize axis, you're blind. Because it has a structure which sets it apart from any other vertebrae. The structure is called dens. Dens is sticking out superiorly. And if you will take this and the atlas, you will see that dens represents the missing body of atlas. Can you see that? Dens, which I'm tapping on right now, represents the missing body of atlas. Dens of C2 is the missing body of C1. Now, dens, we don't have this picture here, but imagine this for a second. This is the C1 and C2 articulating. Can you see the dens? Imagine that there is a ligament around it, surrounding it. What essentially dens provides, it's a pivot. It's a pivot for the head rotation. Dens and C2 is the vertebrae responsible for no movement. That makes sense? Good? Now, again, few words about cervical vertebrae. C3 to C7 share the same structures. Bifid spinous process, transverse foramina, small body, practically non-existent transverse process. C1 doesn't have a body, but have lateral masses and superior articular faucets that articulate with occipital condyles on the occipital bone. C2 and responsible for yes movement. C2 axis. Okay. C2 has dens, which is essentially a missing body of the atlas, C1, and that dens provides a pivot for a no movement of the hand. Are we good? Can we move on to thoracic? 12 vertebrae. Thoracic vertebrae are fairly easy to spot as well. Let me find one. Okay, that's a typical thoracic vertebrae. All 12 of them articulate with ribs, okay, via the transverse costal facet. Okay. Transverse costal facet articulates with the tubercle of the rib, inferior costal facet with the head of the rib. So that's the inferior costal facet. The articulation you can see here. Okay. Ribs articulate, head articulates with inferior costal facet, and the tubercle articulates with the transverse costal facet. Distinctive features. Body of the vertebrae is larger, more weight to bear. Vertebral foramina is round. Transverse processes are very noticeable. The spinous process is long and directed downward. Does that make sense? So downward directed spinous process, noticeable transverse processes, round vertebral foramen, larger body. It also has articular facets. So superior articular processes and facets and inferior articulate processes and facets allow thoracic vertebrae to rotate against each other. So they allow that sliding. Does that make sense? That's why you can do this. That makes sense. Finally, lumbar vertebrae. Lumbar vertebrae are massive. These 5 vertebrae carry the majority of the trunk weight and upper limbs weight. Huge body. Again, triangular vertebral foramen. Horizontally directed, hatchet-shaped spinous process. Articular facets, though, superior articular facet and inferior articular facet, they are oriented so that those vertebrae are locked against each other. Does that make sense? There is no sliding, they locked. That makes perfect sense. Think about this. You have 5 vertebrae at the bottom of your vertebral column. At the bottom, you don't want them to slide because the forces, the vertical forces that act on those vertebrae and on the intervertebral discs can easily damage those intervertebral discs in case the sliding goes out of line. Does that make sense? So those guys, look, there is no rotation in the lumbar region of the vertebral column. That makes sense. Now, what I usually say, and it's sort of a visual rule for the lumbar vertebrae, looks like moose head. Okay? It does look like a moose head, so if you see something like that, that's the lumbar vertebrae. Any questions so far? What kind of vertebrae? What kind of vertebrae? Thoracic. What kind of vertebrae? Cervical. That's what you're going to have. That makes sense? Sacrum and coccyx. 5 fused vertebrae. You can see the lines of fusion between them. Okay. Superiorly, on the sacral promontory, it articulates with the 5th lumbar vertebrae. Okay. This surfaces, the auricular surfaces of the sacrum, they articulate with hip joint. This joint is called sacroiliac joint. Sacroiliac. This part of the pelvis is called iliac. Okay? The openings, called sacral foramina, allow the passage of the sacral spinal nerves. Does that make sense? Now you can see here, I'm not sure if I have, yeah, okay. You can see that that's the fully assembled sacrum. That empty space right here is called sacral canal. In the sacral canal, if you would look at the entire body, you're going to find the tail-like structure of the spinal cord, which is called cauda equina. Cauda equina enters the sacral canal, and sacral nerves leave sacral canal through the sacral foramina. Does that make sense? So you can see the sacral canal, that's where cauda equina enters, and those nerves, they leave through the foramina. Make sense? Okay. Now tailbone, coccyx, 3 to 5 vertebrae, articulates with sacrum and the sacral apex. Nothing too remarkable about it. That make sense? I want to finish the, what's the word? Axial skeleton. Then we're going to take a break. How about that? A little short break. Thoracic cage. If we don't finish anatomy, that's fine. Thoracic cage. How many ribs do we have? 24. Well, according to the Bible, we used to have 25. Well, men used to have 25, right? Then one was used to make a woman. I don't really know where you can stick 25th rib here. I have no idea. So 24 ribs, a pair. Okay. Thoracic cage in general, composed of ribs and the sternum. Okay. They protect the organs. Which organs are you going to find here? Heart, lungs. Part of the liver, yes. A little bit, kind of, a tad of a stomach. A lot of smaller glands, like thymus, is going to be found here. Okay? And the superior mediastinum. What should we start with? Well, let's start with sternum. That's your sternum. It consists of 3 parts. The superficial part here is called manubrium. Okay, on the manubrium you can see the jugular notch. And the place of attachment between the manubrium and the body of the sternum, which is the middle portion, is called a sternal angle. Sternal angle can be seen as the little indentation on the sternum. Xiphoid process, bottom here, it is shown that it's not in this frontal image. It's shown that xiphoid process is not yet ossified. I mentioned it before that xiphoid process ossifies about age 40. Okay. The joint between xiphoid process and the body is called xiphi-sternal joint. Here you can see xiphi-sternal joint, that's xiphoid process. Heart is practically posterior to sternum. So when somebody stands and presumes to put the hand over the heart, it's more of a hand over the lungs. If you want over the heart, do this. That would be more correct. You may slide to the left just a little bit. Okay? That makes sense? Now, sternum and manubrium and xiphoid process articulate with the bones, but they don't articulate like that. They do articulate directly, but those joints are formed by the hyaline cartilage. Those are joints. Ribs that articulate with sternum form 12 pairs. The head of the rib, which is quite interesting, this parts of the rib here are the heads of the rib. Let me see if I can. Yeah, so this, you have ribs. Yeah, you do have them in the bag. If you grab just one, again, I'm not going to ask you which number the rib is if they are disarticulated. That's the rib. Yeah. Okay. Head. Head of the rib, interestingly enough, articulates with the vertebral column. Can you see the heads? Right here. They articulate with the vertebral column. Okay. So first, 7 ribs. And a little word about the anatomy exam. During the anatomy exam, you are allowed to walk to Marvin or Melvin. You are allowed to use modals. Does that make sense? Because I'm going to be using modals too. I'm going to show you things. Say, I may pick it up and ask you, what is that? You will have to tell me what is that. Pick one answer. That makes sense? Good. Sorry. So, one, 2, 3, 4, 5, 6, 7. They're called true ribs. 1, 2, 3, 4, 5, 6, 7. If you would look at all those ribs, they directly articulate with the sternum via the cartilage, the costal cartilage. Okay, so first, second, third, fourth, fifth, no doubt. That's sixth, that is seventh. They true. Also, they are called vertebro-sternal ribs. Does that make sense? Vertebro-sternal. The rest of the ribs, 8, 9, 10, 11, 12, called false ribs. Okay? Those are false ribs, because they do not articulate directly to the sternum. Ribs number 8, 9, and 10. 8, 9, and 10. They're called vertebro-chondral ribs. If you would look at them on the image, you will notice that they do articulate with the vertebrae, right? But then, on the anterior aspect of the thoracic cage, they articulate to the cartilage. Can you see that? 8, 9, and 10, they articulate via cartilage, not directly to the sternum, so they kind of join to the cartilage. Does that make sense? That's why they're called vertebro-chondral. Chondrum refers to cartilage. And the last two ribs called floating. 11 and 12, floating ribs. Also called vertebral. They do not attach to the sternum. That makes sense? So let's go over the ribs again. For 1, 2, 3, 4, 5, 6, 7. True vertebro-sternal. 8, 9, 10. False vertebro-chondral. 11 and 12. False vertebral ribs. Also floating. Now if you would look at the rib head, the larger portion of the rib articulates with the vertebrae. Then you can see that head sits on the thinner part called neck, and after the neck you can see a tubercle. Okay? So tubercle articulates with the costal facet of the thoracic vertebrae. Let me grab thoracic vertebrae. So these facets on the transverse processes, that's where the rib tubercle articulates. The head articulates with inferior articular facet right here. You can see this articulation. Head of the rib, costal facet, the articulation side. Okay? The biggest part of the rib is called the rib shaft. Again, head, narrow neck, tubercle, shaft. Okay? Make sense? So, we're going to take a break. Let's make it reasonably short.